Good evening, everyone. A warm welcome to the session. We are starting a new session along with our DACM, that is the Advanced ECG Workshop. First of all, let me introduce you to some of the courses that we are providing from MedMap. The Diploma in Ayurveda Cardiology, this session is organized by Ayurveda Map and initiated by MedMap. So let's see some of the courses. We have the Professional Diploma in Ayurveda Panchakarma. It's a 6 months course where you learn about Panchakarma, different types of Panchakarma, Karkida Chikitsa, Kerliya Panchakarma, Marma bandaging, etc. We have the Postgraduate Diploma in Sports Medicine and Rehabilitation, a 6 months intensive program which has been NSDC certified, and you'll be receiving hands-on training at Diasman Hospital, Kundoti. There's a diploma in antenatal and postnatal care in Ayurveda, where you'll be having again a 6 months course of hybrid mode. And we have a new course, Stanika Chikitsa in Roga, a 3 months course where you'll be learning about 12 plus localized gynecological therapies. And you'll also receive a 4-day intensive hands-on training at SDM College of Ayurveda, Udupi. We have the Diploma in Ayurveda Cosmetology, DAC, and again a 6 months course where the offline session will be held in Bangalore. And you are familiar with the Ayurveda Cardiology course and the new joinees, the new doctors. I'd like to introduce you to this course, the Diploma in Ayurveda Cardiology. And these are the topics that we will be discussing in the section. Again, a 6 months online training program. Our esteemed speaker, Dr. Shyam Sundar Tarachan sir. And the topic of the day, ECG, Understanding, Learning and Interpretation. This will be the part 1 of the 5-part series.
Good evening to all of you. Good evening. Dear friends, we are having a heavy rainfall here since 2 p.m. And obviously, intermittent electricity issues are there. But
Excuse me, sir, the audio is not clear and the video is stuck also.
nicely here, the knowledge of the. Can you see my slides now?
No, sir, not yet.
Warm welcome here. Today, we start with the basics of the ECG. I had just share one or two things that here we are having a rainfall since 2 p.m. So there may be a issue of electricity, but hope our session will go smoothly. Number one, I hope the slide which I shared is now visible to you, all of you.
Yes, sir.
Slides
The
are
slide is
visible?
visible.
Yes,
Yes, sir. Yes.
yes. Our intention is very clear that as far as cardiology is concerned, ECG is a OPD based investigation which is now essential to understand so that we can decide the line of treatment along with the severity of the disease. And this severity of the disease will definitely, you can take the decision whether to treat the patient at OPD level or should we need hospitalization. Sir Eindhoven, the invention of the electrocardiogram by Sir William Eindhoven in 1901, gave physician a powerful tool to help them diagnose various forms of the heart disease, especially arrhythmias and acute myocardial infarction. ECG or EKG is one of the simplest and fastest tests used to evaluate heart. The electrocardiograph is derived from the Greek word electro, meaning related with electrical activity. Now, the name itself signifies electro, meaning related to the electrical activity. Cardia means heart and graph means to write. So the electrical activity which is happening there in the heart, which results in contractions and relaxation of the heart muscle. These things you understand from the word electrocardiogram. Each portion of the heartbeat produces different deflection on ECG. These deflections are recorded as a series of positive and negative waves on normal ECG. There are typical 5 visible waveforms, that is P, Q, R, S, and T wave. Sir Eindhoven was born in Indonesia in the year 1860. Before Sir Eindhoven's time, See, I am talking before the Sir Eindhoven's time. It was known that electrical currents were produced by beating of the hearts. Try to understand. यही बात चरकाचार्य ने भी कही है अरिष्ट विज्ञान में। जो स्पंदनशील अवयव है उनकी चर्चा चरक ने इंद्रिय स्थान में की है, अरिष्ट सूचक विज्ञान में की है। द सेम थिंग, द सेम स्टोरी। The electrical currents were produced by beating of hearts. But this phenomena could not be measured accurately. This was the situation before Sir Eindhoven. So, without placing the electrodes directly over the heart, the electrical impulses generated were not graphically presented. This problem was noticed by Sir Eindhoven. Sir Eindhoven completed series of the prototypes. He introduced the galvanometer, and this galvanometer, the impression on the graph is successfully noted. The original machine, the slide which I shared with you here, this is the original machine, ECG machine. This machine required cooling water for powerful electrical magnets. See, the leg is immersed and left hand is also immersed in a pot. See in the picture. It requires 5% to operate it. The form of ECG machine and the slide which I shared here. See the difference. 5 persons were required here to operate this machine. And this machine weighed around 600 pounds. So heavy. Now, the portable ECG, nowadays, the ECG machine is now available in your mobile also. This device increased the sensitivity standard galvanometer so that electrical activity of the heart could be measured here. Despite of insulation of flesh and bones. Much of the terminologies used in describing ECG or EKG originated with Sir Eindhoven. His assignment of the letters P, Q, R, S, and T to the various deflection is still in use. Sir Eindhoven described the electrocardiographic features of a number of cardiovascular disorders after his development features of number of cardiovascular disorders after the development of galvanometer here. So this is a small introduction of the ECG over here. The historical background and its importance, the journey of innovation of the ECG machine in short. We here now very important point which is I am going to share over here. Whenever you are reading the ECG, one of the point is electrical axis. So the basic of the electrical axis, what you understand, left axis deviation, right axis deviation, what is its clinical importance, and which type of abnormality by knowledge of electrical axis you can understand. Before going into the detail on the topic electrical axis, I want to introduce you here with the term electrical axis. Electrocardiography is the recording of electrical impulse that are generated in the heart. This is the basic thing. Each and every cell of the heart, electrical impulse is generated. When there is a myocardial infarction, that particular group of cells, that particular part damaged, necrosed, dead. So no electrical activity is noted, and that study on electrocardiogram will give you the knowledge of myocardial infarction. A khali ECG within a few seconds, the physician can diagnose the patient had infarction. So, before going to that particular end point, first take the knowledge of electrical axis At the end of this session, I will solve what are the protocol which points you to understand while reading the ECG. That points I will share. I will share the answer, ideal answer I will share, and then I will give you some exercise that at your end you should try to solve the ECG with the points we discussed. The first point is electrical axis. So, electrocardiography is a recording of electrical impulse that are generated in the heart. When you look at the ECG of a patient, there are some positive deflection and there are some negative waves, there are some positive waves. ECG पर कई वेव्स ऐसी होती है कि वो ऊपर की तरफ होती है और कई वेव्स नीचे की तरफ. Why this happens? This answer lies here. Try to read the diagram, the slide which I shared with you. The impulses initiate the contraction of the cardiac muscle. The term vector. Now, first term I introduce you electrical axis. Now, the second term in the today's lecture, I am going to make you aware about the term vector. See, the ECG is very simple to read. This is based on physics. This is based on mathematics. So the first term axis, second term, I would like to make you familiar with vector. The term vector is used to describe these electrical impulses. The vector is a diagrammatic way to show the strength and the direction of the impulse. Now look at the slide which I shared. Some arrows, some impulses, they are approaching to the middle line. Some are going away from the middle line and some are neutral. Try to understand this. All these impulses, see, every cell of the heart generating electrical impulse. All the impulses together is known as vector. The vector add up when they are going in the same direction. The electrical impulse, बिल्कुल सिंपल लैंग्वेज में समझिए. हर एक सेल में इलेक्ट्रिकल एक्टिविटी होती है, इलेक्ट्रिकल इंपल्स जनरेट होता है. वो जनरेट हुआ इंपल्स जब they are moving in a same direction, some vectors, they get cancelled if they are moving in opposite direction. But in case they are at an angle of each other, they add or get subtracted. and this will give you the resultant direction of the flow. For example, there are 50 impulses, they are moving in a same direction coming to the central line. There are 40 impulses, they are moving in an opposite direction. So the resultant will be the 10, which is giving you the positive deflection. When the impulses generated moving in a one direction, they are in number 40, and the impulses generated going away from each other, they are in number 50. The resultant vector will be negative. When the impulses generated moving in same direction, they are 50 in numbers, and the impulses generated moving opposite direction, they are also in number 50. So the resultant vector will be the isoelectric line. I will show on the ECG paper. That may be a slight positive or that may be a slight negative. For example, you all are 12th pass student. So there is a vertical axis is a y axis and horizontal axis is a x axis. x axis के ऊपर जो डिफ्लेक्शन है वो पॉजिटिव है, x एक्सिस के नीचे जो डिफ्लेक्शन है वो निगेटिव है, और x एक्सिस के स्लाइटली ऊपर या स्लाइटली नीचे या x एक्सिस पर जो डिफ्लेक्शन है वो न्यूट्रल वेक्टर है. For your convenience, I am explaining here x and y axis. Therefore, ECG is a measurement of these vectors that pass under electrode. See the first figure, which is a negative deflection. See the third figure, which is a positive deflection. Now come to the middle figure. There is a isoelectric line, that is a plane line, which you can say x-axis, then positive deflection, then negative deflection, and then isoelectric line. How you will read this diagram? How you will read this graph? The resultant vector is positive, the resultant vector is negative, and the resultant vector is isoelectric line. The electrode or the lead which you are fixing on, there are 6 chest leads and 4 limb leads. We are studying here 12 lead ECG, but we are fixing here only 10 leads, 6 chest leads and 4 limb leads. By fixing 10 electrode or by fixing 10 leads, we are getting 12 impression on the ECG paper. Had you asked this question to yourself? What is the definition of the vector? Vector is whatever the electrical activity happens where you fix that electrode, that activity below that electrode is carrying and graphically presented on the paper, and this is known as electrocardiogram. अब आपने 10 इलेक्ट्रोड फिक्स किए हैं और आपको 12 लीड ईसीजी 12 इंप्रेशन आपको मिलते हैं. This I will explain afterwards. Try to read the two terms, electrical axis and electrical vector. So, in a fine language, ECG is a graphical representation of electrical movement of the main vector passing under that electrode, passing that under lead which you placed. Electrodes are, now I'm making you familiar with next term, electrode. Electrode are sensing devices that pick up the electrical activity occurring under it. Now, I think the basics, नेगेटिव डिफ्लेक्शन क्यों है, पॉजिटिव डिफ्लेक्शन क्यों है, किसे पॉजिटिव डिफ्लेक्शन कहते हैं, किसे आइसो इलेक्ट्रिक लाइन कहते हैं, नेगेटिव डिफ्लेक्शन का अर्थ क्या है. आई थिंक these basics this concept is now clear in your mind. This is physics. When a impulse is moving away from the electrode, the ECG machine converts it into negative wave. Look at the first negative deflection. इस फिगर को आप, how you will read this negative? The impulses generated moving away from the electrode, the ECG machine converts it into negative wave. जैसे ही आप निगेटिव वेव को देखते हो तो आपको ये अंडरस्टैंडिंग हो जाना चाहिए कि द इम्पल्सेस आर मूविंग अवे फ्रॉम द इलेक्ट्रोड. In very simple language, I am explaining this slide. In 2-3 different ways, I try to convey what is negative, what is positive deflection, and what is isoelectric line. When the positive impulse is moving towards the electrode, the ECG machine convert it into positive wave. Look at the third figure, that is positive deflection above the isoelectric line, or for your convenience. See what I am talking. For your convenience, the horizontal axis is the x-axis. Above the x-axis is positive. Below the x-axis negative. For your convenience, I am giving you the example of x and y axis. When the electrode is in middle of the vector, the ECG machine converts it into positive deflection for the amount of the energy that is coming towards the electrode, and negative wave for the amount of the energy is going away from the electrode. See, I am giving you the explanation of the isoelectric line. Sometimes this isoelectric line is slightly above the x-axis or slightly below the x-axis. When the forces coming in a one direction and forces going away from each other, they are equal in number, you will get isoelectric picture. That electrical impulse, that electrical resultant vector, which is graphically presented on ECG paper, is isoelectric in nature, slightly positive or slightly negative. Same thing which we discussed. The second pattern in continuation. That pattern I shared here so that your idea about three different things. One is resultant vector, positive deflection, negative deflection, and isoelectric line. These three terms I introduced here and hope this concept is clear in your mind. आपने जो इलेक्ट्रोड फिक्स किया या जो लीड और उस लीड के नीचे जो इलेक्ट्रिकल एक्टिविटी, उस एक्टिविटी को आपने ईसीजी ग्राफ पेपर पर क्या किया, ग्राफिकल प्रेजेंटेशन कैसे होता है, यू अंडरस्टैंड नाउ हाउ दिस इलेक्ट्रिकल एक्टिविटी हैपन्स. So I would like to make you familiar with conduction system of the heart. This is related with the chalaguna property of the vatado. From one spot to other, the impulse generated is traveling. If there is any obstruction, if there is any abnormality, if there is any hyperkinetic activity, so you can understand chalaguna vriddhi, chalaguna kshaya. I am making you slowly familiar with how to read the ECG based on the Tridosha Siddhant. Now, look at the picture. The conduction system of the heart consists of 5 specialized tissues or 5 specialized cells. Number 1, sinoatrial node, SA node. See the SA node, which is situated in right atrium. Right atrium upper side. Look at the figure number A. The pink spot in the right atria, upper side. Many times what happens? First degree, second degree, third degree heart block. If your concept here is clear, then you will understand the first, second, third degree heart block, and or otherwise you will not understand. These are the basics. You all are aware about all these things. Just I am revising here. So the 5 specialized cell is sinoatrial node, then AV node, atrioventricular node. Next is bundle office, left bundle branch LBB, and right bundle branch, that is RBB. And last specialized tissue is Purkinje's fiber. As the impulse arises in SA node and travels through atria, look at the figure number 1. Look at the arrow. The impulse generated at SA node traveling through atria to AV node. If I ask you to read this figure, figure number A, how I will read this figure? Impulse generated at SA node traveling through atria this reaches to AV node. This results in depolarization of atria. What is happening? कोई भी ECG पर graphical presentation जो है, that is related with some or the other activity which is happening there in the heart. Without any action, movement, impulse, nothing will go on graph paper. How the atria depolarize? When we are talking about atria depolarization, that means contraction of the upper chamber, simultaneously the further story is clear in your mind that the wall opens and blood pour from the upper chamber to the lower chamber. यदि यहाँ पर कोई गड़बड़ है, if there is a delayed action, if there is a hyperkinetic action, so you will understand the upper chambers are properly pouring the blood to the lower chamber very fastly or very slowly. Take this figure seriously. Try to understand. Don't look at four chambers are there and some arrow is there and some pink material is there. Not like this way. We are still on the figure number A. We are dealing here with atrial depolarization. ऐसे में इम्पल्स जनरेट होगा, वो इम्पल्स ट्रेवल करेगा, एवी तक के तरफ जाएगा, एट्रियल डिपोलराइजेशन होगा. In very simple language, I am trying to convey how to read the figure. From the atria, impulse reach to AV node where there is some delay. I will ask you number of the question on the next slide. And I want proper answer from your side. No guess, no gappa. Perfect a scientific answer I will require. From SA to AV, but there is a small delay at AV. This delay will allow the atria to contract and pump the blood into the ventricles. This is a time required to emptying the upper chamber. The word delay, the wall opens, the blood comes from the upper chamber to the lower chamber. It takes some time. This time, the word used is delay. The impulse is later spread along with bundle of his left and right bundle, branch, and finally through Purkinje's fiber, ventricular depolarization happens there. Atria का contraction, depolarization, ventricle का depolarization. What the event when ventricle depolarize? The blood from the right ventricle pump through pulmonary artery goes to the lung. There will be a exchange of carbon monoxide with oxygen, and on right ventricle through aorta, the pure blood will go to the body parts. इतनी चीज आपको समझनी चाहिए. When you read the echocardiogram will give you the knowledge of these four chambers, the four walls, the dimension of the chamber, the nature of the cardiac wall. When your physiology is correct, then you can understand very easily, you can understand the echocardiogram. So the depolarization of the atria and depolarization of the ventricle. When the impulse reaches to the Purkinje's fiber. Now read, now listen properly. The dominant pacemaker is SA node, where the first impulse generated. Atrial cell, AV node, bundle of His, right bundle branch, left bundle branch, and Purkinje's fibers, along with myocardial cell, are the other pacemaker site. कई बार ऐसे होता है कि impulse is not generated at SA node. Then how heart is functioning? How you will understand on the ECG paper that impulse is not generated at SA node? How you will correct that deformity from the perspective of Ayurveda also? When the impulse is generated somewhere other than the SA node, which are the other pacemakers? AV node, bundle of His, right bundle branch, left bundle branch, Purkinje's fiber, myocardial cell. All these are other centers or other site of the pacemaker. मैंने एक प्रश्न आपसे पूछा था. Once again, my curiosity is there. When there is a hyperkinetic activity and the cardiologist implanted pacemaker there in order to make the correct rhythm of the heart. मेरा प्रश्न है, जिस पेशेंट को पेसमेकर बिठाया गया है उस पेशेंट पर आप हृदय बस्ती करोगे या नहीं करोगे? Will you advise हृदय बस्ती to the patient in pacemaker implant happened there? ये मेरा प्रश्न है, ये मेरी क्यूरियोसिटी है, and I want scientific answer of these things. हाँ करेंगे नहीं, not like that way. No gappa. Based on the science, if you have any reply, give me the reply in the box. When SA node falls, these other pacemaker site can initiate impulse at slow rate. Underline the word slow rate. Now, the rate of the pacemakers beats per minute. At SA node, the normal rate SA node 60 to 100 beats per minute. At AV node, that is 45 to 50 beats per minute. Bundle of His 40 to 45 beats. Bundle branches 40 to 45 beats per minute. Purkinje's fiber, Purkinje's cells 35 to 40 beats per minute. Myocardial cell 30 to 35 beats per minute. My question to you: when you are examining the pulse rate, can you explain, can you correlate, can you establish with the slide which I shared. Take your own time. When you say water hammer pulse, when you say 3D pulse, when you say two beats are present and third beat is absent, that means the conduction is not proper when you miss some beat. And we are here learning the basics. I am asking here a very basic question. When Purkinje's cells, the impulse reaches, ventricle gets contracted. Now, can you correlate this slide with systole and diastole? You all are doctors. I coined here two curiosities. One with pulse, and second one is systolic and diastole. Why I am talking? I am in coming lecture, we will reach to that point, systolic dysfunction, diastolic dysfunction of the heart. When you are eager to understand these terminologies, then the basic concept should be clear. When you are reading 2D echocardiography report and that report is showing systolic dysfunction, so these are my curiosity. Take your own time and try to give me the explanation of all these things, or in due course, definitely I will cover these points. Any disturbances in the sequence of stimulation, which stimulation? The impulse generated at SA node, SA to AV, AV to bundle of His, from bundle of His to Purkinje's fiber. If this sequence, there is any disturbance, these specialized cells, already we are discussing here 5 specialized cells, leads to rhythmic disturbance of the heart, and this is identified as arrhythmia or conduction abnormality called as heart block. Many terms today regarding the axis, vector, 5 specialized cells, arrhythmia, and heart block. over here since last half an hour. We are discussing and get aware about the new terminologies here. Now, the 5 specialized cells we discussed. And at the beginning, we understand the impulse generated at right atrium, that is SA node, from SA to AV and onwards. Now the question is how the impulse start generating in SA node. Or you can take it in other language. Each and every cell of the myocardium is working as a electrical impulse generating unit. हर एक सेल में इलेक्ट्रिकल इम्पल्स जनरेट होता है. जब वो एक डायरेक्शन में जाता है, you get the positive deflection. When they are going away from each other, you will get negative deflection. When they are negative and positive, their resultant vector is 0, then you will get the isoelectric line. This basic concept we understand. अब प्रश्न ये है कि हर एक इलेक्ट्रिकल सेल में, हर एक हार्ट के सेल में इलेक्ट्रिकल इंपल्स कैसे जनरेट होता है. As you are Vaidyas and you are performing Shodhana Chikitsa, exclusively about the woman and Virechal, what precaution you have to take, otherwise patient will have heart block. पंचकर्म एक्सक्लूसिवली वमन और विरेचन करने से पहले एक प्रोटोकॉल है कि आपको ईसीजी कर पेशेंट का फिटनेस लेना जरूरी है, मैंडेटरी है. If you ask me why, I will reply you with this physics. Look at the figure number 1. The basic principles of the electrocardiography. The basic principles involve physiological and electrical event that occur in single muscle cell, which forms an electrical unit. Already we discussed each cell is a electrical unit. Make your concept clear and try to stick to your chair. Today is the first day of our ECG session. We may require to sit here for a longer time to make the concept clear. We are not in hurry. We are not in hurry. Simultaneously, we are touching to those points which are related with Ayurveda. Each single muscle cell forms electrical unit. Outside of the cell is positive with respect to inside of the cell. Now look at the figure number 2. When I was student, I'm talking somewhere 38, 39 years, 86, 87, I'm talking 1987. When I was student, I draw these figures. When nobody taught us ECG in the college. We ourselves studied. So during that period, the notes which I'm sharing here with you. If the surface of this cell is stimulated, the impulse generated at a synode, if you stimulate, that portion becomes electrically negative due to the transfers of the ion, mainly sodium and potassium across the cell membrane. Where the portion of the cell that has not received the stimulus is still electrically positive. I think the figure number 2 you understand. जैसे ही आप स्टिम्युलस दोगे, that portion starts becoming negative due to the exchange of the sodium and potassium ion. Why the cardiologist prescribe the Kesol, potassium chloride? Why the electrolyte study is important before giving the Shodhan Chikitsa? If this rhythm, if this ion of the sodium and potassium get disturbed, patient may have heart issues there. So the significance of the electrolyte study before and after Shodhan Chikitsa. Now come to the figure number 3. The potential difference between the two surface. Which two surface? Inner surface and outer surface. Electrode gives rise to an electrical current, producing deflection in the galvanometer. What the Sir Eindhoven did, he fixes the series of the galvanometer to note the deflection in the electrical impulse. Shayad, maybe my language today, all this physics you are revising, somehow all your old memories you recall, and hope you are digesting the concept figure number 1, 2, and 3. The deflection in the galvanometer. Once the cell is stimulated, the electrical negativity spreads from the one end to the other end. Now, the difference between figure number 2 and figure number 3. In figure number 2, partially the stimulus reached and partial that portion become negative. In figure number 3, the stimulus reaches to the other end, so the outer surface become negative and inner surface become positive. And this process result in depolarization. हृदय का आकुंचन होता है, कॉन्ट्रैक्शन होता है, हृदय का प्रसरण होता है, डायलिटेशन होता है. ये टर्म्स, to speak out these terms are very easy, but what exactly happening, and these movements you are capturing, the leads or the electrode you fixed, and that activity is noted graphically on the paper, that is ECGs. Now, try to understand. This slide is very difficult for you to understand. When I will teach you which leads are bipolar and which leads are unipolar, then you will understand this figure. So the basics is very clear. The basic is here in this slide which I shared, but this is for bipolar and this is for unipolar. So these activities, what is happening initially the impulse, stimulation, and this stimulation, the positive surface becomes negative and negative surface become positive, and this results in the depolarization. And here the repolarization takes place. So these events are happening. Definitely we will revisit these slides when I will teach you the bipolar and unipolar lead. Then we will come back here on this, and then definitely you will understand these concepts very nicely. Now, here I shared the ECG paper. I will make you familiar with normal ECG morphology. Normal ECG morphology. This is not a simple paper. Lot of things you to understand. And this will help you to calculate the pulse rate, to calculate the normal PQRS waves, their vertical displacement on y-axis, and at the same time their displacement on the x-axis, that is on the horizontal axis, and the normal values you have to summarize so that abnormal things you can notice. This is not easy. This is not a simple paper, graph paper. Number of the stories are here. Number of the concepts are here. Normal ECG paper with big and small boxes. The dark line showing you the big box and the faint small boxes. Each big box is made up of 5 small boxes. Slowly we are proceeding. धीरे धीरे हम आगे बढ़ रहे हैं. एक बिग बॉक्स में 5 स्मॉल बॉक्सेस से बनता है. एक बिग बॉक्स. Each small box measures 1 millimeter in height. That means these small 5 boxes is made up of 5 millimeter. 1 millimeter in height. One small box. In other language, the vertical displacement of the one small box is 1 millimeter. And 0.04 second width, that is horizontal displacement. 0.04 multiplied by 5 is equal to 0.20 second. When one wave, that may be a P, Q, R, S, T, horizontal displacement is measured in unit second and vertical in millimeter. These basics of ECG paper once again revise it properly tomorrow, day after tomorrow, before coming to the next lecture. One small box on horizontal axis displacement or the width 0.04 second and vertical 1 millimeter. I am talking here about the small box. Now the physics portion is now over. Mathematics portion now started. And already I told you ECG is nothing but physics and mathematics. Physics का portion complete हुआ, अब शुरू हो गया है mathematics. Summarize this slide 100 times. Within a fraction of second, you have to calculate the pulse rate. You have to calculate the P wave, Q wave, R wave, T wave, ST segment, PQ segment, PR segment, their normal displacement, normal width, abnormal width, and what it signifies. जब तक नॉर्मल नहीं पता होगा, एबनॉर्मल का अभ्यास करना मुश्किल है. Now, this is normal ECG morphology. I already told you if there is a positive deflection, first positive deflection, unless and until you understand why there is a positive deflection of the P wave, what you understand, what is happening there in the heart, क्या हो रहा है, इसलिए ईसीजी पेपर पर पी वेव का ग्राफिकल प्रेजेंटेशन या ट्रेसिंग हमें मिला है. सो द पी वेव इज रिलेटेड with the event atrial depolarization. That means the impulse is generated at SA node traveling through atria towards AV node. There is small delay. How that delay is on the paper? There is a isoelectric line. After, see the dome-shaped P wave. First of all, there is an isoelectric line, then start positive deflection, then dome shape coming down and reaching once again to the isoelectric line. P wave completes here. After completion of the P wave, there is a isoelectric line. What you understand by this isoelectric line? This means there is some delay in emptying of atria into ventricle. Each and every tracing on graph paper is related with the event which is happening there in the heart. P wave का जन्म हुआ है. The birth of the P will give you the knowledge of atrial depolarization, followed by isoelectric line, means the blood is emptying from atria to ventricle. From the isoelectric line, there starts a negative deflection, that is the birth of the Q wave. That Q wave comes and reaches to the isoelectric line. Q wave completes over there. There onwards, there is a positive deflection, that tall R wave. Positive deflection comes and reaches to the isoelectric base. This is baseline, isoelectric line, or for your convenience, x-axis. R wave completes there. From there, there is a negative deflection, that is S wave. That negative deflection comes and once again reaches to the baseline or isoelectric line. There the S wave completes. आपको ये सीखना चाहिए, आपका ये अंडरस्टैंडिंग क्लियर होना चाहिए कि Q वेव कहां से शुरू होती है, कहां खत्म होती है. R वेव कहां से स्टार्ट होती है और कहां खत्म होती है. In the same way about the S wave. So altogether, this QRS complex represents ventricular depolarization. What you understand? The impulse from the AV node reaches to bundle of his from right bundle branch, left bundle branch, and Purkinje's fiber. When that reaches to the Purkinje's fiber, myocardial cell, ventricular depolarization completes. When the S wave comes and reaches to the isoelectric line, there onwards you find a isoelectric line followed by positive deflection. That positive deflection is ventricular repolarization. Ventricle expand हो रहे हैं. QRS complex, ventricle contracts. So the blood in the ventricle ejected from right ventricle to lungs and from left ventricle to the body part. When there is a T wave, the birth of the T wave give you the knowledge of ventricular repolarization. This is the normal morphology of the PQRS and T wave. Now, this is important to understand epicardium, myocardium, and endocardium. Now, my question to all of you. When we are talking about coronary blockages there, where the coronary obstruction in epicardium, myocardium, or endocardium, which thing burst? And you recognize that identity as myocardial infarction. So the three layer here, epicardium, myocardium, and endocardium. The same picture which I shared with you, when you give a stimulus to the cell, the outer part which is positive, that starts becoming negative due to the exchange of the ions, sodium and potassium. When you are using diuretic drugs, that may be a Lasix, Lacilactone, Ditor, Tide, in treating the patient of ascites, when you are giving, there are some shlokas, Samanya Chikisa Sutra, Kamaletu Virechanam, Tamketu Virechanam, Udritu Virechanam, Nityameva Vireche, Pakshagate Virechanam. These are the Samanya Chikisa Sutra guided by our acharyas. But periodically, when you are subjecting your patient on Nityameva Virechayet, you have to periodically check the electrolytes. For a longer period in Kamalitu Virechanam, Pakshagate Virechanam, Tamketu Virechanam, and if you ask me, related with my topic cardiology, in hypertension also, you may need to subject your patient on Nityameva Virechayat in order to reduce the cardiac load when your ejection fraction is low, the pumping is slow, pumping is hampered. The cardiologist advised to patients and restrict the fluid intake. Now, my next question to all of you. When you carry out any radiological investigations, for example, angiography, a dye is passed to visualize all the images properly on the screen. That heavy metal dye passes through kidney, that filters through kidney. After angiography, serum creatinine level goes up. Most of patients. And this lingers for a longer time. Not for angiography, any type of investigations that require to pass electroisotopes in order to visualize properly the imaging, that material is always excreted through kidney, and that hampers and that boosts the creatinine level. And in such a condition, when ejection fraction is low, the cardiologist advised to restrict the fluid intake. My thought is very clear. When there is no normal functioning of the heart muscle due to the myocardial infarction, due to the blockages there, and for imaging purpose, you passed a dye, and that results in increasing the creatinine level, and that lingers for a longer time because kidney is not washed properly, because you restrict the fluids. And one fine morning, the creatinine, urea, all the renal functions hampers. So whenever I used to talk with my friends, cardiologist friends, I request them, we agree with fluid restriction due to the hamper of the ejection fraction, but medicated water, Shadanga Paniya, this Shadang Paniya, whenever patient is on restricted fluid, replace the normal water by Shadang Paniya. Our aim is to remain the blood alkaline, not acidic. This will help you. The medicated water will help you to flush the kidney, and to my opinion, to my experience, we can help to the modern science that the creatinine level after the injecting the isotope, we can achieve the results and make the values normal, replace the normal water with Shadanga Pani. आप ट्राई करके देख लो. What I am talking here, just you, if you have a patient with a restricted quantity of the fluid, liquid intake, replace the normal water with Chadan Pani. And then go for the reading of RFT. That is, sometimes this hampers the glomerular filtration rate, GFR also. These isotopes, these radiopaque dye, because they have to excrete from the through kidney only. Now we can summarize here. See, this is the P wave is atrial depolarization, QRS complex is ventricular depolarization, and T wave is a ventricular repolarization. What is happening at the same time? This is the P wave during diastole. This is a ventricular filling time. QRS complex is ventricular contraction. T wave is a ventricular ejection. When the ventricular depolarization is happening, at the same time, what is happening there? In atria, atria is filling with the blood. So these events are also in this way you can read. So this is all about today. One slide which I want to share over here, and that is related with the ECG paper. When we are talking about the one small square displacement on the horizontal axis, that is on the x-axis, that require 0.04 second, that can be very fastly summarized. 2 millimeter displacement on horizontal axis will require 0.8 second. In this way, 5 small square is equal to 1 big square will require 0.20 second. So this calculation, this table, you have to summarize it very fastly. 5 स्मॉल स्क्वायर मिलकर एक बिग स्क्वायर तैयार होता है, एक बिग बॉक्स तैयार होता है. एक स्मॉल बॉक्स को एक्स एक्सिस पर डिस्प्लेसमेंट करने के लिए 0.4 सेकंड टाइम चाहिए, तो 5 स्मॉल स्क्वायर को डिस्प्लेसमेंट के लिए 0.20 सेकंड चाहिए. That means 1 big square is equal to 0.20 seconds width on horizontal axis. This is all about today. We start with the ECG, and now the session is open for you. If you have any queries.
Thank you, sir. Participants, you may unmute and ask sir any queries you have. Also, please share your feedback on the session.
Everybody is not attending the class. They are just going attending the IPL now. I think so. Match is going.
Sir, we have a question here. What does ST segment suggest?
Hmm?
Dr. Paul Mehda, I think.
Yeah. Paul Mehta. What does ST segment suggest? ST segment is suggesting that ventricle, there is a pause. The ventricle contraction is going on. This we will take in very detail, ST segment and its abnormality, how it indicates regarding its role, knowledge of the ST segment and its role in understanding the myocardial infarction. We will go to that topic in very detail. So any isoelectric line is a pause, and that is for the filling or emptying of that particular. At which stage Shodhana will be preferred in Rudroga. Shivesh, we are having a separate time and topic dedicated to Panchakarma, and I think 2 lectures are there. Everything we will share. कैसे करना है, कब करना है, क्यों नहीं करना है, all the Panchakarma, Shodhan, Vaman, Virechan, Basti, Nasya, everything, and the role of Rakta Mokshan in the management, role of Takradhara in the management of essential hypertension. I presented 2 papers in the 13th International Congress on Hypertension, Montreal, Canada. That paper, role of Takradhara in the management of essential hypertension, and second one is role of herbal medicine in the management of the coronary heart disease. Both the papers I will read when we will reach to that particular topic. My request to all of you, remain in continuation. If you break this series, next lecture you will not understand what is going on. So before coming to the next session, revise 10 times. Revise 10 times, go and read all the recordings. At your end, make your pace clear. I will promise you at the end of this session, after 5 days, 80% of your ECG reading will go correct. QRS complex, particularly Q wave suggest bundle of is, R wave suggest a, and S wave suggest Purkinje's fiber. Is it like that or it happens? No, it happens simultaneously. Is there any other question? Dr. Ananya, Shivansh, Srikant, Dikshit, Srinivas, you have any query that you can raise your. Now, no need of any book for you. Lot of things are available on the net. You can refer it. So many ECG exercises are also there on the internet. You can go and refer, and some good book if you want. Then at the end, I will share. Here, I'm not. doing that business that my book is very good book, not like that way. But I will share some good books with you at the end. We have the fine notes, handwritten. My notes are also there. Wherever that required, I will definitely share with you. ठीक है, madam. We can wind up the session now.
Okay, sir. Thank you. Participants, if you have any other queries, you can post it in the group. Okay.
Okay.
Thank you, sir. Thank you for the session. Thank you so much.
Thank you. Good night to all of you.
Good night.